In innumerable ways, science has made our lives easier and more convenient. However, if not used properly, this tremendous tool has the potential to devastate lives. There were times throughout history where it was dangerously employed for political purposes. Furthermore, science's quest to push the frontiers of what is previously known might result in heartbreaking scenarios. This list of terrible cases makes us reflect on how powerful and destructive science can be when not handled appropriately. So, in this video, we are going to talk about the most dangerous scientific experiments in history. Starting off with number 1, Project MKUltra. The CIA's famed Operation MKUltra was an attempt at mastering mind control. The program began in the 1950s and appeared to run until 1966. MKUltra subjects were frequently coerced into taking drugs, particularly hallucinogens like LSD. People were subjected to sleep and sensory deprivation, hypnosis, sexual abuse, and other forms of psychological torture, with some tests proving death. The supported goal of the project was some combination of chemical weapons research and efforts to create mind-controlling drugs to combat the Soviets. Number 2. The Tuskegee Syphilis Experiment. Between 1932 and 1972, some 399 African-American syphilis patients in rural Alabama were denied treatment as a result of the fictitious study that was financed by the government. Despite the fact that penicillin was discovered to be effective against syphilis in 1947, doctors continued to blame patients' poor blood and did not inform them that they had died from syphilis. The United States Public Health Service undertook this experiment to examine and determine the natural progression and effects of untreated syphilis. 100 people died as a result of associated problems, whereas 28 died directly from syphilis. Number 3. Weaponizing the plague. When a plague roamed around Europe, it killed about half of the population. In the 13th and 14th centuries, around 100 million individuals were killed, lowering the global world population. It was discovered in the 1980s in the Soviet Union's biological warfare research program on how to use the plague as a weapon by launching it in a missile warhead at opponents. Aside from the plague, defectors disclosed that the Soviet bioweapon program had tons of smallpox and hundreds of cargoes of anthrax. Number 4. The Large Hadron Supercollider. In Switzerland, this scientific device is renowned as the most advanced and largest machine in the world. It was designed in order to learn more about particle physics. However, the people were terrified by this machine. At that time, people believed it was also responsible for bringing asteroids to Earth and generating earthquakes. Although such conspiracy theories have been debunked, the LHC was accused of having the capacity to create black holes that may consume the Earth. The institution that manages the collider, CERN, does not entirely exclude this notion. CERN stated that the LHC is not harmful, although it does have the potential to create a black hole. Number 5. The Aversion Project. Between 1971 and 1989, a medical torture project was launched in South Africa. Their purpose was to cure the homosexuality of the military conscripts. Apartheid, a legal framework that upheld discriminatory laws against non-white South Africans, was used to carry out the project. This project involved coerced aversion therapy procedures such as chemical castration and electric shocks. The army took part in this scheme, which caused approximately 900 sex change surgery procedures. In the medical world at the time, homosexuality was considered a mental disease. Dr. Aubrey Levin, the project's professional chief psychiatrist, was charged with violating human rights and was later sentenced to prison by international organizations. Number 6. The Milgram Experiment. In 1961, immediately after the start of the trial of Nazi war criminal Adolf Eichmann, a scientist called Stanley Milgram decided to conduct a sociological research. He was questioning if Eichmann and his followers and accomplices were simply carrying out orders and were not evil without a doubt. An actor and a test subject were involved in the experiment. They could communicate, but not see each other. The test subject would pose questions to the actor, who would respond. Every incorrect answer was met with an electric jolt. In this instance, the test subjects frequently persisted in shocking and inflicting pain after being instructed to stop by the victim. They proceeded because a higher authority informed them that they would bear no responsibility and that there would be no long-term consequences. Number 7. Kola Super Deep Borehole, a Soviet project that began in the 1970s with the goal of digging as deep into the Earth's crust as possible. The Soviets successfully pierced a 12-kilometer hole into the Kola Peninsula in Russia's far northwest in 1994. This resulted in scientific discoveries, such as the uncovering of ancient remains of microscopic plankton from its 24 species. Nothing contradicting transpired, but there were fears about the abrupt generation of seismic impacts as a result of excessive drilling, or maybe cracking the entire world apart. The experiment's hole is now closed as of today. Number 8. Guatemalan STD Study, another dreadful experiment carried out in the name of science in the United States. From 1945 to 1956, approximately 1,500 Guatemalans were deliberately afflicted with STDs, such as gonorrhea and syphilis. Subjects in this heinous experiment included military conscripts, orphans, inmates, and prostitutes. To infect their participants and carry out their experiment, researchers employed unethical practices that included infected prostitutes and injections. The subjects filed a $1 billion lawsuit against Johns Hopkins for its role in the experiment. Number 9. Unit 731. During World War II, the Japanese army tolerated brutal experimentation on individuals as part of a secret research and development program. Shiro Ishii, their general in command, commanded Unit 731, where nearly 250,000 women, men, and children experimented in the name of science. The majority of the subjects were prisoners of war from the Allies and Russia, as well as Chinese victims. Forced surgical procedures include vivisections, which is the practice of cutting and operating on live subjects without anesthesia, limb amputations, and the removal of internal organs such as the liver, lungs, brain, and other organs. Forced pregnancies, biological warfare, frostbite testing, and weapon testing with flamethrowers and grenades were all performed on the subjects. And finally, at number 10, the Nazi concentration camp experiment. Thousands of concentration camp inmates were utilized in Nazi medical research. These experiments included induced hypothermia, the use of malaria to infect individuals, poisoning people, forced sterilization, the use of mustard gas on prisoners, and many more. Josef Rudolf Mengele, the archetypal evil doctor, is the Nazi doctor to blame for such experiments. He paid special attention to and focused on twins, the majority of whom are Roma and Jewish. Mengele, widely known as the Angel of Death, was responsible for atrocities like removing people's organs without anesthetic, mutilation, and injecting captives with fatal bacteria, among other things. Mengele also used the eyes of murdered victims for his heterochromia studies, and attempted to prove the resilience of Roma and Jews to diseases through his tests. So that's the end of the video. Make sure to like the video, subscribe to our YouTube channel, and press the notification bell so you never miss out on our next videos. Until the next video, take care.